So welcome back. Now the word lupus comes from Latin meaning wolf because these patients would get a red rash with a raggedy edge that would look like a wolf bite. But there are many things in the 1800s that are also called lupus because they would have similar rashes. It wasn't until 1895 when our friend Dr. Osler renames this disease and starts calling it systemic lupus erythematosus, realizing that it's not just on the skin, but it can also be on the inside of the body. Now, what is lupus? So remember, everybody has an immune system. It stays medium. It protects the body from infection or cancer, but when it's overactive the wrong way and starts attacking the body, it can cause an autoimmune disease instead. And in lupus, it can cause rashes, especially when the sun hits the skin. It can cause losing of hair, sometimes bald spots. It can cause sores in the mouth. It can cause brain problems and nerve problems. It can cause heart and lung problems, especially water around the heart or lungs. It can cause kidney problems, and it can cause joint problems leading to arthritis. It can also attack the blood counts on the inside, making these patients very anemic, and as a result, the patient will get more tired or more fatigued. Now, who gets lupus? It's actually more common in women, especially between the ages of 15 and 45. It is more common in Black people, Asian people, and Latino people. And it does run in families, but it's not 100% genetic. You can't explain 100% of the causes due to family history alone. It is a very rare disease. So if we take the example of how many people do I need in a room to have a certain disease, well, if I have 10 people in a room and I watch them for 1 year, one person will get diabetes. I would need 50 people in a room for one person to get thyroid. As we learned, I need 1,000 people in that room for one person to get rheumatoid arthritis, but I would need 10,000 people in that room for one person to get lupus. The testing in this disease is very confusing because it can make some things high, it can make some things low, but by far, probably the most confusing test is the ANA, or the anti-nuclear antibody test. And the ANA is simply an antibody in our immune system. So it can be what is called falsely positive, meaning it can be high even though it's not causing lupus, the disease itself. So it can be high whenever the immune system is irritated, such as in infections or cancers. It can be high in other diseases like thyroid disease. It can be common in certain people like white women above the age of 40. It can be common with certain medications. So what I tell patients is that the ANA is kind of like being told you have blue eyes. There are times when your eyes will look more blue or they will look less blue, but they will always be blue. So this testing can stay positive for life. The other confusing thing about this test is usually it's given as a number, a ratio. And what that simply means is that blood is taken from the body and it is watered down or it is diluted down. And if it's diluted down 40 times and the ANA is there, it's called 1:40. If it's diluted down 80 times, it's called 1:80. And the higher that number means that the blood was watered down more and more and the ANA was still there. So then maybe it is actually disease causing. As far as the diagnosis of this disease, again, it can be very complicated, but basically, since this is a very rare disease, the first thing is to rule out other common causes of a positive ANA, such as infections or hormones or other diseases, cancer, etc. And then the next thing is to see if the symptoms and what we see on the body of the patient is matching up with the blood work, and is the body really being attacked the right way for it to be called lupus. And by far, probably the most common thing in patients with lupus that leads to the diagnosis is that positive ANA, the rashes that are very specific, and arthritis or joint stuff. As far as the treatment for lupus, the first and foremost is to try to avoid the sunlight because for some reason the sun activates something in the skin that then activates something on the inside and causes it to be a more systemic disease. There are a lot of medications out as well, but they do have some side effects. So sometimes having the body less stressed out because it's already being overwhelmed by this disease. So eating right, exercising, sleeping well, avoiding stress. And then these medications, remember, they all push down the immune system, or most of them, and they can put the patient at risk for infection or cancer. And these medications can come as pills, they can come as injections, they can come as IVs. As far as the prognosis of lupus, actually today it's very good. Even less than 100 years ago in the 1950s, most patients who had lupus were expected to die within 5 years, and we've kind of reversed that number. Now, most of our patients are expected to survive 10 years or even more. And usually, what is affecting our patients from not living as long is heart disease. Because again, there's damage already there. And then you add to that anything like diabetes or blood pressure or cholesterol, and it just speeds up heart disease very quickly. And then the side effects of the medications. Again, it can put the patient at risk for infection or cancer. It's a small risk, but it is there, which makes me want to end with, again, the diagnosis in this disease is probably the most important part of it, because it's a very rare disease. It can look like other things can look like it, and the testing is very confusing. As Dr. Osler would say, medicine is a science of uncertainty and an art of probability. Until next time.